I was involved in releasing time to care when I worked within a health team as a clinical lead. Was introduced to the programme around about 2009 and used the tools and the methodologies within that team. Could see the benefits of it and enjoyed working with the principals at that point. So coming into a new role as a service manager working with other disciplines in the areas of health and social care, I could see that the tools and the methodologies were transferable, that these were things that we could do in any setting, and it would benefit our service, it would benefit our staff and our service users.
I spoke to the nurses about it, and I think they'd had the box and had been speaking about it, but I really didn't know what was involved, and certainly didn't think it was, to do with care homes. So when Karen asked, would we pilot it, I was right up for the idea.
Well-organised working environment. We've managed to look at our storage facilities as a whole, put new systems in place for simple things like finding the right sling for somebody. So we did a huge audit of our slings and slip sheets, and we've got them in boxes that have got a picture of the sling and the size, and we got the laundry person involved so she knows where to put them at the end of the day. It's also a good way for us to see when we're running out. So if one's not fit for purpose anymore, there's a piece of paper in the bottom of that box that says how many medium sizes we have. It's stroked off and the date that it was informed to the senior so that we can replace it.
We had a table that had so many folders of paperwork on it. It was really quite daunting, especially to new staff, and time taken. So we streamlined all the paperwork that was the daily paperwork that was done.
When you were toileting someone and you needed to go get a pad, you had to go all the way to the room. I was wasting a lot of time and you'd maybe get caught doing something else. Where now you can just get the job done.
Pads are stored in a cupboard in the toilet rather than stored in their bedrooms. So if they're toileted in the toilet in the main area, the staff member doesn't have to leave them on the toilet till they go all the way to the bedroom to collect the pad.
Nice of
yeah,
them, isn't it?
And it's their own prescription pads, it's there and they're all labelled so it's the right ones, they're getting used by the right people. Big area that we thought that we used a lot of time, so we thought would be better was going from cloth napkins to paper napkins and paper tableware, because obviously there's a lot of time spent on ironing and the laundering of that, but then the quality that the residents liked was the napkins. So that got taken into patient perspective module then, and we did a questionnaire with them and they came back that they wanted the linen, so even though it saved
on
cost and time,
yes,
we've gone with what the residents want.
That the residents
enjoyed taking part in the lead of the patient status at a glance module. I changed the handover board. I think it's improved communication, also a wider awareness of important information about the resident, and the nurses also look at the board, so it's brought us all together as a team.
Sometimes it's very frustrating when you're doing something when you know it could be done better, and then when you have the change you feel like your workload makes more sense, so it makes you feel a bit better about the whole situation.
Very often small tests of change rather than big projects. Same with the kitchen. I mean, and that was the thing, releasing time to care went across every department and made huge difference to the kitchen staff, how many times they had to go sort of the length of the building and upstairs just to the store and to find what they wanted, to go back again to order what they were needing to then put the deliveries in. So, when you counted that time as well, measured it, it was a big saving. So that's where I said it may be about staff attitudes, because it's very difficult sometimes at the beginning to get absolutely everybody on board with it, when you've got so many different shifts, for example, like night shift, and it's not always easy for them to be that involved because of the time of it.
Releasing time to care was a really good idea, and I think it's made a lot of improvements for people, the staff as well as the people who live at St Peter's House. I think one of the concerns is releasing time to actually do the work off the floor. It's been a big concern, and spending time with the stakeholders involved in the improvements.
So we went to a multidisciplinary team meeting in the hospital, but I felt was really beneficial, because then just by chance we actually got somebody discharged to the unit that had been discussed at that meeting, so I had an insight into the person before they came. and myself and Lynn's working on a document now that we're hoping to put in for the information that we feel we need when somebody comes back to us for the unit, which would save a lot of phone calls and time for us and the nurses. So that's a thing that's still kind of progressing. I think it's brought us together with the ones in the hospital and the community, and within each unit I think we're working better between St Peter, St Ronald's and Smithy Bray.
In surgery, I mean, we've worked with the district nurses and the health professionals from women's surgery through the releasing time to care.
That's because I think we just know one another better.
Yes.
And we'll phone up and say, what do you do for this, or have you got a form for that? And the units are all using the same paperwork now, so that it's streamlining everything.
For a unit,
it would have been good, like if the equivalent charge nurses, or I don't know what they call them, terms now, if they could actually come and see and be involved, because I don't think they have much idea of what happens in the units here, and I don't think it was helped that day that we went in.
There are huge benefits of being part of it, of taking it on and getting the staff involved in it. The one thing that I was really looking forward to Releasing Time to Care bringing to the staff group as a whole was purely a sense of ownership for the staff, to give them a sense of initiative, a sense of, as Julie has always said, just do it. If you think it's wrong, if you think it could be improved on, then improve. The idea of time wasting just becomes part of day-to-day stuff. Everybody just blends into their day-to-day work. That's just how it's done. And you don't think about challenging the ideas. But we have managed to do a lot of different things that may not have saved huge amounts of physical time, but it's actually just a better way of working as well. We've managed to improve communication, we've managed to improve our medication auditing system, simple ways, just through produced a patient status at a glance board. We've changed our entire handover system. I take a lot of pride in the fact that the staff have taken ownership of the project, and they just feel they can use their initiative a bit more rather than relying on the senior team or their colleagues for simple questions. They know where to find the equipment, they know where to access the information. It's the basics we've done.
I think Releasing Time to Care has been a big benefit within the residential units. It's given the staff the opportunity to bring changes to the way that they do things for their benefit and that of the residents. I think it gave staff and seniors throughout the team the chance to make a change, because maybe before you just did things because that was the way they did, but this kind of opened it up and made you think about why you did something and made you be able to change it without being questioned as to why change it if it works.
One of the greatest things about using Releasing Time to Care has been social care is an ever-changing environment. It's a very busy area of work, very challenging, and by using Releasing Time to Care and the staff being able to change protocols, change the way that they work, to improve the way that they work, they've managed to start enjoying their job a lot better, and it has really benefited the residents. It's a more happy place to work.